You think a little numbness or dry skin on your feet is harmless? Think again. What starts as a small cut can turn into a nightmare. Blackened toes, gaping wounds, even amputation. Most people never see it coming. But in this video, you'll discover what really causes feet to rot alive. Welcome to Levitas. What is diabetic foot? Diabetic foot is one of the most dangerous and under-recognized complications of diabetes. It refers to a cluster of foot problems that occur in people with poorly controlled blood sugar levels, leading to nerve damage, poor circulation, foot ulcers, infections, and, in severe cases, amputation. The condition develops slowly, but can escalate rapidly without warning. The first signs might seem subtle: numbness, tingling, or dry, cracked skin. But underneath, high glucose levels are damaging nerves and blood vessels, slowly stripping the body of its ability to heal and defend itself. Over time, this can result in open wounds that won't heal, often going unnoticed because the person can't feel them. Once an ulcer forms, bacteria can enter, causing deep infections that affect muscles, bones, and tendons. These infections are incredibly hard to treat in diabetics due to immune suppression and circulatory issues. If left untreated, the tissue begins to die, resulting in gangrene, a condition where the skin turns black and the foot literally rots while still alive. Diabetic foot isn't rare. It's estimated that up to 25% of diabetics will develop it. And once it starts, it can be terrifyingly hard to reverse. What is diabetic neuropathy? Diabetic neuropathy is a type of nerve damage caused by chronically high blood sugar levels, and it plays a central role in the development of diabetic foot. Over time, elevated glucose damages the small blood vessels that nourish the nerves, especially those in the hands and feet. As the nerves degenerate, the ability to feel pain, temperature, or even injury diminishes. This lack of sensation is called peripheral neuropathy, and it makes patients unaware of minor injuries, like cuts, blisters, or pressure from tight shoes. When someone doesn't feel pain, they don't realize something is wrong, and injuries go untreated. Even worse, damaged nerves also affect sweat glands, leading to dry, cracked skin that is more vulnerable to infection. The muscles that control the feet may weaken, changing the shape of the foot and creating pressure points that increase the risk of ulcers. Diabetic neuropathy also alters how the body responds to wounds, reducing local immune function and healing capacity. Without pain to signal danger and without proper nerve signals to regulate circulation, even the smallest foot injury can snowball into an emergency. Neuropathy doesn't just numb the foot, it silences the body's alarm system. Why does poor circulation happen? Poor circulation, also known as peripheral artery disease, or PAD, is extremely common in people with diabetes, and it's a major contributor to diabetic foot. Chronically high blood sugar damages the endothelial lining of blood vessels, making them stiff, narrow, and prone to atherosclerosis, a buildup of plaque that blocks blood flow. The feet are the farthest point from the heart, and often the first to suffer from poor circulation. When arteries are blocked, less oxygen and nutrients reach the tissues, and waste removal is slowed. This creates the perfect storm for wounds that don't heal and tissues that slowly die. Without proper blood supply, the body's natural immune response becomes compromised. White blood cells can't travel efficiently to the site of injury, leaving it vulnerable to infection. Even powerful antibiotics struggle to reach infected areas when blood flow is inadequate. Poor circulation also leads to cold feet, pale skin, and slow-growing toenails, but these signs are often ignored. In the context of diabetic foot, it's deadly. Without blood flow, you can't fight infection or repair damage, and that's when ulcers turn into gangrene. It's not just about sugar, it's about blood flow too. Why are foot ulcers more common and hard to heal in diabetics? Foot ulcers are open sores that form on the skin, usually on the bottom of the foot, and they're alarmingly common in people with diabetes. Why? Because three main factors collide: neuropathy, poor circulation, and weakened immunity. First, due to diabetic neuropathy, people often don't notice when they develop a blister, cut, or callus. They keep walking on the injured area, worsening the wound. Second, poor circulation means that the ulcer receives limited oxygen and nutrients, slowing down the healing process dramatically. Third, high blood sugar interferes with the function of white blood cells, weakening the immune response and allowing bacteria to thrive. What makes ulcers particularly dangerous is their tendency to go deep, penetrating not just skin, but reaching muscles, tendons, and even bone. These deep infections can cause osteomyelitis and, if left untreated, lead to tissue necrosis and amputation. Healing a diabetic ulcer is an uphill battle. It often requires removing dead tissue, specialized dressings, offloading pressure, antibiotics, and sometimes surgery. Even then, recurrence is high. Up to 40% of patients with a healed ulcer will develop another within a year. The key isn't just healing them, it's preventing them. Why infections become common? Yes, infections in the feet are incredibly common in people with diabetes, and they're often severe. High blood sugar creates an environment that impairs the body's natural defenses. It slows down immune cell function, reduces circulation, and provides a rich food source for bacteria. When a foot ulcer or crack in the skin appears, it becomes an open door for bacteria, fungi, and even viruses. In healthy individuals, the immune system can often fight off such invaders quickly. But in diabetics, white blood cells don't respond effectively, and antibiotics may not reach the site due to poor blood flow. This allows infections to spread rapidly, often going deeper than they appear on the surface. In some cases, infections reach the bone or trigger systemic sepsis, a life-threatening condition. Common signs include pus, swelling, redness, odor, and fever. Infections that are not caught early may require hospitalization, surgical drainage, or even amputation. The risk of losing a limb is real and far more common than people think. In fact, diabetes is the leading cause of non-traumatic lower limb amputations worldwide. A single infected ulcer can change someone's life forever. How to resolve diabetic foot? Resolving diabetic foot requires a comprehensive, multidisciplinary approach that addresses not just the wound, but the root causes behind it. Step 1 is strict blood sugar control. Without it, no treatment will be effective. Medications like GLP-1 receptor agonists, along with a low glycemic diet, are essential to reduce inflammation and support healing. Next is wound care. This includes debridement to remove dead tissue, sterile dressings, and pressure offloading using custom footwear or orthotics. Podiatrists, the wound care specialists, and vascular surgeons may all be involved in managing the case. If infection is present, targeted antibiotics are prescribed. In severe cases, surgical intervention may be needed to remove infected tissue or restore blood flow. Angioplasty or bypass surgery can be considered if circulation is severely compromised. Additionally, foot hygiene becomes critical. Daily foot checks, gentle washing, moisturizing, and toenail care help prevent future ulcers. Smoking cessation, weight loss, and exercise improve circulation and healing potential. Diabetic foot isn't just a skin problem, it's a systemic issue. Healing takes time, coordination, and dedication. But with early intervention and the right team, even severe cases can be managed and sometimes reversed. Why is prevention the best strategy? Prevention is the most effective and least painful approach to managing diabetic foot. Once ulcers or infections start, treatment becomes complicated, costly, and risky. But simple habits like daily foot inspections, proper footwear, good hygiene, and blood sugar control can drastically reduce your risk. Early detection of nerve damage, circulatory issues, and skin changes allows for timely intervention before wounds appear. Educating patients and caregivers on foot care routines and warning signs makes a powerful difference. Prevention isn't passive, it's proactive. And in diabetes, it's the line between keeping your feet and losing them. What are other common diabetes complications? Diabetes affects much more than blood sugar. Over time, it can lead to serious complications across multiple organs. Diabetic retinopathy can cause vision loss, while diabetic nephropathy may lead to kidney failure. Cardiovascular disease is also common, increasing the risk of heart attacks and strokes. Nerve damage from diabetic neuropathy can affect digestion, bladder control, and sexual function. Skin infections, slow healing, and fatigue are widespread. Mental health issues like depression and anxiety are also frequently overlooked. Uncontrolled diabetes slowly and silently impacts every system. But with the right care, many of these complications are preventable and even reversible in early stages. In conclusion, diabetic foot is a silent, progressive threat fueled by neuropathy, poor circulation, and impaired immunity. Even a minor injury can spiral into ulcers, infections, or amputation. Without early detection and glycemic control, healing becomes a battle. But with prevention, daily care, and multidisciplinary treatment, this dangerous complication is manageable. It's not just about feet, it's about saving lives from the ground up. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.